again. How is it humanly possible that it's Friday once again? Okay, having said that, some good news if you like chocolate. Now, you've heard about chocolate and dark chocolate specifically and the benefits to the heart. Eaten in moderation, certainly. But this is a new one, and it's a Harvard University study. And what it says is that a daily dose of the sugary treat may help prevent Alzheimer's disease. It's a new research at Harvard Medical School found people who drank 2 cups of hot cocoa a day had improved memory and blood flow to the brain. But here's the other thing, though. I mean, and I wish, as soon as we get Dr. Samadi on, we'll talk to him about this. You got to be careful. If you have diabetes, you're not going to be drinking hot cocoa, right? If you're overweight, you add 2 cups of hot cocoa a day to your diet, you're going to keep gaining weight, or if you're borderline, you're going to gain more weight. So there's always a good and a bad, and it's never black and white, as they say. But this is encouraging. So we're going to talk to Dr. Samadi about that, ladies and gentlemen. And we're also going to talk to Dr. Samadi about another very interesting story, which has to do, not necessarily the Obamacare website. We'll do that if we have time with him. But also blood pressure drugs. So those of you taking certain blood pressure drugs may lower your risk of Alzheimer's as well. And that's a Johns Hopkins study. Anybody ever have drink beer with Johnny Hopkins? Sorry, that's a movie from, what is that, Step Brothers? A line from Step Brothers. All right, do we have Dr. Samadi ready to go? Because he looks ready to me. All right, hello, Dr. Samadi, Lenox Hill Hospital, Fox News Channel. How are you, sir?
Steve, fantastic day. Nice to talk to you. How are you?
I'm great. And it's good to talk to you, sir. Okay, so good news on 2 fronts. If you're looking for good news on Alzheimer's disease, first is the chocolate study out of Harvard Medical School that found people who drink 2 cups of hot cocoa or hot chocolate or whatever a day had improved memory and blood flow to the brain. The second, which you could address also, is that certain blood pressure drugs lower the Alzheimer's risk. That's from Johns Hopkins. Let's start with the chocolate. While that's great if you love chocolate and hot chocolate and dark chocolate, still in all, you can't just go around eating chocolate if you're A, diabetic, or B, overweight, or watching your diet. So it's kind of a mixed bag, right?
Absolutely. And the big question, even before we discuss this, is why are we talking about Alzheimer's almost every Sunday and in some of your shows? What's so special about Alzheimer's? And that's part of the reason why we're having so much problem with Medicare, is because people are living longer, and Alzheimer's and osteoporosis and some of these chronic diseases are going to become a real entity. Before, when people were living, the average lifespan was 72, it wasn't a big problem. Now people are going to their mid 80s and 90s, and so Alzheimer's is going to become a real issue. And unfortunately, we have difficult time with the diagnosis, and there's really no treatment. All we know is that some of these anti-inflammation things such as chocolate and cocoa are the ways to go. Now, you're right. If you're diabetic, you're not going to be able to take a lot of this. But you heard me talk about blueberries and strawberries. Any kind of berries have a lot of anti-inflammation. They can clear the free radicals, and they're absolutely helpful with reducing or slowing down some of the issues with Alzheimer's. When it comes to these medications, and you said some of the blood pressure medications can also help with Alzheimer's. This is a new study that we are finding out coming from Johns Hopkins. And what they found was that over 2,000 participants who were going to go and take this ginkgo biloba that we thought may help with Alzheimer's, it turns out that they didn't. But on the observational one, they found that the ones that were taking blood pressure medication, diuretics, ACE inhibitors, we're actually reducing the risk of Alzheimer's by 50%. This is a big, significant medical breaking news, and we need to follow up on this. The question is it the blood pressure medication that's helping with this, or is it lowering the blood pressure that can reduce the Alzheimer's? And that's unknown at this point, but that's a very exciting news coming today.
Yeah, no, absolutely. There's always so much out there, and I love getting it explained. But you were talking to Dr. David Samadi, Chairman of Urology and Chief of Robotic Surgery at Lenox Hill Hospital. You watch him on Sunday on the Fox News Channel, House Calls. Okay, let me ask you this. I'm sorry, another study, and you and I have talked about this low T and how you have to be careful with getting the treatments. And if you watch the ads for the medication, some of them on television, your 2-year-old baby could start growing a beard, and you're subject to a lowered immune system and all these kinds of side effect possibilities. But here's one, according to Boston University School of Medicine. Boy, a lot of studies coming out in the past couple of days. Testosterone treatment in men with low T has been shown to cut their heart disease risk. Now, again, talk about that, but again, there are other mitigating factors. People who are conscious about their health and willing to take these tests and find out about it and undergo treatment are probably living a better lifestyle. But go ahead.
I think treating the testosterone should not be a knee-jerk reaction. It has to be a real detailed discussion with the family and the patient, and making sure that we don't just react on the number. Number one, make sure you get your testosterone early in the morning, because testosterone in the afternoon is going to be much lower. So always check your testosterone around 7 to 8 a.m. in the doctor's office. If the low testosterone is really symptomatic, something that called menopause, male menopause, where you can't move, you're tired, you're exhausted all the time, socially you don't want to interact with people, you're gaining weight, and it's interfering with your sexual life, etc., that's when the doctor should intervene and give this testosterone. This has to be done after the PSA level for prostate cancer has been checked, because if someone's PSA is high, you don't want to give them all these testosterones. Having said that, we know that low testosterone can cause diabetes and lead to heart disease and stroke, and even interfere with the osteoporosis. So replacing the testosterone in selected group of men could really help them tremendously. And we see that based on this study can reduce the cholesterol, can reduce the heart disease. So my reaction to this is really individualize the care, talk to the patient, and find out who really needs it, and not follow some of these ads that we see on TV all the time.
All right, so one final question. We got about a minute and 10 seconds left. This Obamacare rollout, and what's even worse is these insurance companies dropping individual policyholders millions across the country just in the last few days.
I think clearly this hasn't been well thought of. They're finding out that the rush of people, over 700,000 people were trying to get in. Their computer system and the softwares are not taking care of this kind of mass volume coming in. So clearly, there hasn't been a good infrastructure set up for this. And, when everyone was worried about Obamacare 6 months ago, a year ago, I surprised you, even though I'm not a big fan of it. But I said, just let it roll. And you're going to see that short term, we're going to see a lot of mess, but long term, good doctors will come to the surface and the patients are going to follow them. This is nothing but, taking care of the quantity of volume of people. And I'm afraid the quality is going to be affected. And you know me, it's one of the reasons why, I always individualize and take care of the patients hands-on.
Right.
This is going the wrong direction, and it's a big problem.
Yeah.
And so,
No doubt. Doc, thanks for joining us. We'll watch you Sunday on Fox News Channel, and we'll speak to you again next week.
Good to see you.
Thank you, my friend. All right, Dr. David Samadi, ladies and gentlemen, Lenox Hill Hospital, here on the Steve Malzberg Show. When we come back, the former U.S. ambassador to the United Nations, John Bolton. We have so much to talk about. Iran close to a bomb, very close. Steve Malzberg Show, Newsmax TV and Radio.